great, real great. You just stay over there and we'll just...
Got it.
Okay. That's better. Okay, ready?
Yeah.
Okay. Hi, everyone. I feel like paparazzi's on. Okay, so blood vessels. This model, the only thing we normally ask is that there's a circle of Willis here. This model is not the greatest because it doesn't actually show the circle, but at least remember when you see that model, circle of Willis with a capital W. So here's the circle Willis right here, okay? You have, that's the most important thing. These inner ones, it's very hard to see here, are the internal carotid arteries, okay? Carotid means going to the neck, right? Cerebral would be up in the head itself. Other than that, for the most part, that's all you need to know, okay? All right, go ahead. Okay.
Let me give you a blank one. Hang on, right here. Sideways.
Okay. Can you get out of the slideshow?
Flip it.
And then flip it, yeah.
These are the ones I was trying to print.
I think there's an option to. Oh, ta-da! That is awesome. She is an awesome professor. Don't you guys love her?
Yes.
Okay, here we go. In the head, right here, you see that this is your face. So that's your facial artery, the red, and the blue is the facial vein. Now you can also say mandibular too, but we tend to use facial up there, mandibular. Can you pull this down? Can you pull it down more? No. Grab here. And just pull. Yeah. Thank you, because I'm short. Yeah. That's not funny. Now these are all your cerebral arteries because they go to your cerebrum, and your cranial arteries on the outside. Cerebrum is on the inside because that's the brain, the biggest part of your brain. Now, if this is your temporal bone, and then you would have your temporal arteries and veins here. Okay, parietal is the same thing. But these are basically cerebral arteries and veins, red arteries, blue veins. Here's your facial artery and vein. I don't think you need to know mandibular, don't worry about that. But what you need to know for the arteries is that coming off of the aortic arch, the middle one here is your left common carotid artery, patient's left, common carotid artery. Common meaning it's going to split into something else. So common is like a trunk, it's going to split into branches. So this left common carotid artery is going to split into the external carotid artery, which is right here, okay? Right, going here, going to go onto the face. Whereas the internal carotid artery, which you cannot see right here, but it's right underneath here, is going to go inside, and that's going to go into your brain. So common carotid artery goes into the external carotid artery and the internal carotid artery. The internal goes inside. You see how this is going inside the brain? And this is going to go on the outside. Okay? That's your artery. When you do the... Actually, let's just do arteries only. When you do arteries... can you...
Picture up?
Yeah, picture up, please. Okay. So when you're in the thoracic area, okay, so when you're looking at the heart, the artery, here's the ascending aorta, aortic arch or arch of aorta, okay, and then you have the descending aorta. You can't really see this part of the descending aorta, but because it's above the diaphragm, it would be called thoracic aorta, and below it is the abdominal aorta, where you see abdominal aortic aneurysms. Okay. So right here coming off, you have the brachiocephalic trunk, which is the first exit off of the aortic arch. The brachiocephalic, remember brachio, upper arm, braccia, upper arm, like biceps brachii, right? That's going to go to your arm. And the brachiocephalic, cephal means head. So this brachiocephalic trunk, you can't really see very well, is a red piece that's going to split to the arm and the head. Now, when it goes up to the head, the neck is common carotid artery, but now this is the right one. When you go down the arm, this right here, there's a bone right here, the clavicle. So this is subclavian artery. You can see it here too, but what's nice on this side is it literally gives you boundaries. So this is it right here. So it would be picked on here also. When it goes down here and it gets to the next to the head of the humerus, that's axillary, meaning under the arm. So if you're not sure where here, just look for the head of the humerus and go, oh, axillary artery. When you come down further, right next to the shaft or the diaphysis of the humerus, now you're talking brachial artery right here. So this would be brachial artery over here. When you go down further, which I don't need to show you right now, but radial artery goes to the thumb, ulnar artery goes to the pinky. That's fine. Now, right here, can you make this bigger by any chance?
Yep.
Great. Thanks. Okay, in this area here, it's not pixelated, right? You can see it. So you have your abdominal aorta. Now the key is to know where the organs are. On the right-hand side, this is the liver. These are the two kidneys in the back. This is the spleen, and right here there should be a stomach, but we actually have it removed so you can see this. So in the abdominal aorta, the easy ones are going to the kidneys. These red ones here are the renal arteries, right, left and right. Okay. Now, then when you come down here, these long squiggly things, I think of long squiggly like the tail of a sperm. These are gonadal arteries. These go to the gonads. In the model, it looks like it's going to the leg artery, but that was a mistake on the model. They shouldn't have done that. So these are gonadal arteries. In a woman, that would be ovarian. In a man, it would be testicular. Okay, but just call them gonadal arteries. That's fine. This little thing right here will go to the bottom of your intestines. So they're called mesenteric arteries. Okay, entero means intestines, mesenteric, between the intestines. Okay, so that would be all down here. If you look here, can you see this like four-way intersection right here? The one that comes down like 6 o'clock off the intersection, that's your superior mesenteric artery. And a lot of people confuse it on the test because they think, oh, it's going down, it must be inferior. No, it's going down because this is going to be the top of your mesenteries. This is going to be the bottom of the mesenteries, and it's going to be like this. Okay? So superior mesenteric arteries, inferior mesenteric arteries. The one going to the spleen is called splenic artery. Okay? No left or right on that. If you put left or right, you're going to get it marked wrong because there's only one spleen. Okay? And it's only one E. Just splenic artery. This one here going off to the right is called the common hepatic artery. Hepatic, like hepatitis, this deals with your liver. So the common hepatic artery is going to the liver. You can't call it hepatic because common means it's going to split because you got 4 lobes in your liver. So the common hepatic artery is now going to split into different hepatic arteries, which you don't need to know that. This one going straight up is called the left. Think of it how it's like dipping to the left here. Left gastric artery. There is a right gastric artery. It's not shown on here, so don't worry about it. But gastric refers to belly or stomach, okay? So, and right here, the four-way intersection is called celiac trunk, C-E-L-I-A-C. Celiac trunk. Please don't say cephalic. A lot of students will say cephalic accidentally. That's celiac trunk. Why don't you stop this so that we can not make the video too long? Do you want to make, can you make it smaller? Or
What do you want to look at?
oh, actually,
you want the leg?
no, this is actually very good. This is good, but while they're doing that, can you just rotate this?
Yeah.
Yeah.